This is a WKYT podcast.
Good morning from WKYT News. I'm Bill Bryant. Welcome to Kentucky Newsmakers, where we'll go in search of answers and some perspective this morning. The coronavirus pandemic has changed all of our lives for now, and maybe in some ways forever. Historian Bryant has agreed to join us on the phone. He'll give us some context about how Kentucky faced up to the Spanish flu of 1918 and some of the hard economic realities that have come along over the years. Also this morning, Greta Van Susteren on the federal response to COVID-19. But first, an expert that we have turned to for comfort and information during this coronavirus pandemic, Lexington Emergency Room physician, Dr. Ryan Stanton. Our guest joining us remotely this weekend so that we can observe social distancing, and in this case, so that Dr. Stanton can keep working on the front lines. So he's using a remote app, and we appreciate that very much, Dr. Stanton. Understand if you need to go. Senator Mitch McConnell has said this week, our lives have been transformed in the blink of an eye. Let's talk about this. Is this COVID-19 pandemic playing out as was anticipated?
I think it is playing out in some ways like we anticipated. I think we've seen, with the growth in the cases worldwide, the death rates that we're seeing in the United States here, we're seeing about a 1.5 to 1.6% of the known cases. And I think that's an important message to drive home, is that we are not doing a ton of testing in the U.S., so there's probably a lot more numbers out there we're just not seeing. But really, when he says this has changed things, it's no matter what happens with regard to the virus moving forward, this is going to permanently change lives, not just because of the virus itself, but because of the economic impact, the disruption of businesses being closed, of people not being able to go do the things they normally do, the schools being out, the sports being canceled. I mean, this truly is an unprecedented type of thing that, of course, I don't think anybody has ever seen, and probably not something that has been seen the likes of which since probably World War II, where there was such a change on the home front because of the needs for overseas. And we're even talking about some of those things here where automakers are talking about making ventilators and other types of medical supplies. I mean, this is a huge shift, and I think it's, in a way, it's of course very scary and worrisome for the country, but also I think it's something that hopefully will bring the country together and kind of tear down some of these partisan walls, some of these things that have kind of pulled us apart over the last number of years, to really understand what is important, which is the life and health that we take for granted on many occasions.
You're a great observer of people. I've noticed that in talking with you. Are you impressed by what you have seen in terms of the teamwork in getting ready for what we know is happening and about to happen?
It's been a great mix, and the things I'm seeing that have been a big mix are, one, the responses of like our governor, and then of course with public health officials, including Dr. Stack. They have done an incredible job. I love the way they're communicating. The things that are a big concern for me that haven't been really happy with has been the U.S. response in terms of personal protective equipment. I mean, we're changing rules for exposure for healthcare professionals because of the access to personal protective equipment, not because of anything necessarily with the virus. We are approaching it quite differently. Now, in terms of the healthcare response, I've been very impressed with the physicians, the nurses, the PAs, nurse practitioners, other staff within the hospital, housekeeping within the hospital, everybody coming together to work as one. I mean, it really is impressive being back here at work, seeing how everybody's working together, common goal, kind of making sure that we're taking care of each other, that we're taking care of our patients, we're still doing the things we have to do on a daily basis, but seeing that response has been really impressive. But I do, hope that the United States can really crank up production of the personal protective equipment, and most importantly, I want to see us significantly expand our abilities to test people, to set up these drive-through testing that people can do, come up if they've got symptoms, get the swab done, within a day or two, get those results back. And I think that is just around the corner, but at the same time, we need to make that available so we know really how much we're dealing with, how many people have this virus, and then really start to see what happens when we start to flatten out this curve and start to work through this over the next couple of months. The great news is China's starting to crank stuff down even today. They're returning flights back to London, starting to get back to a normal life, so we kind of see how long theirs took place, and we're hoping with the early interventions that the United States and other countries have done that we can make that curve even faster.
Yeah, I was going to ask, do we see any light at the end of the tunnel, and are you encouraged by what you're seeing with those numbers finally coming down in China?
Yeah, I'm definitely seeing, very happy with what's going on with China, that they've got the numbers way down. And then countries that have a number of cases but very few deaths, just a very low number. You have this stark contrast between places like Italy and then other countries nearby that have very few deaths but high numbers. And we want to mirror those types of numbers where we address this type of thing, test, take the appropriate steps, and though we'll see the virus, we won't necessarily see the number of deaths. And as we see these numbers in diagnosis in the United States, that number is slowly getting pushed down. We started near 4%, and right now, as of this morning, calculated out about based on the advertised numbers that we have here in the United States, our death rate is 1.5%, and I think that number is going to continue to push down. But we still have to make sure that everybody understands that this is a real risk, and 98.5% of people across the board right now are going to do okay with this illness. But that 1.5%, somebody's got to be that, and we don't know 100% who that's going to be. We do know some risk factors with age and other comorbidities, but it can be really at this point almost anybody can get the virus, of course, and the severe symptoms can happen. I mean, we've got a physician, emergency physician in Washington State right now that's in their 40s, that's on life support, that's intubated, and so it really can be anybody, and we want to make sure that everybody understands these steps are uncomfortable but necessary to protect ourselves and our fellow Americans.
Dr. Stanton, Governor Beshear, as we mentioned, acted very early to start putting restrictions in place. Those have tightened as the days have gone along. Schools, colleges closed, basketball, other sports over for the season, the Derby postponed. Are we doing what we can, do you think? Are the restrictions tight enough, and are people complying enough?
I think we're in a pretty good place right now with the cancellation, social distancing. Look, we're not trying to wipe out completely interactions. We see significant change with 50% decrease and 75% decrease, and they've put those graphs up multiple times during his updates, and I think they've done a good job at being on top of this. His response has actually garnered a fair amount of national attention on calm leadership and updates and information, so I think it's well respected around the country on how our governor has responded, and I think the closures and restrictions right now are a good thing, and hopefully by doing this and doing a lot of things up front, we can actually get back to more stuff earlier. I mean, sports are going to be pushed back, but I hopefully get some of these businesses back opened up, get more access to help these folks that are going to have strains on their small businesses and on their restaurants and employees. I mean, we're seeing a lot of folks that are hiring right now with places like Amazon and Kroger's, but we need to make sure we get as many people back to work as soon as possible, but that means we have to make the sacrifice now. And what I'm seeing is, yes, for the most part, I think a lot of people are respecting it, but you're also seeing, such as this case of the person who was positive, who refused to quarantine and is now under guard, that other people are very selfish and are putting themselves in front of the health of others and those around them. And I think that is haphazard, and we need to make sure that everybody out there is taking appropriate steps to protect themselves and others. Let's just do this for the spring.
Right.
And then once we get back, hopefully by mid-spring, late spring, we'll get back to a more normal state of life.
Doctor, let's just remind folks, best practices right now. What precautions should we have in place as individuals in workplaces if people do have to be there?
The most important thing is, of course, social distancing. That 6 feet is something that's been quoted quite often. Making sure that you wash your hands frequently. So washing your hands for 20 seconds with soap and water. Wet them first, add the soap, scrub your hands, and then thoroughly dry them. All of that process is very important. And then throughout the day, in between hand washings, which do them as much as you can, using the hand sanitizers, especially if you have to touch something else, sterilizing your work area. And that's exactly what I did when I came into the emergency department this morning. Is the first thing I did was cleaned all of my workspace, the computer keyboard, the phones, the dictation devices, even the arms of the chairs where I'm sitting. You know, everybody needs to do that to kill those germs, wipe them out, to decrease that exposure risk, and then decreasing those interactions. This is not a time to be shaking hands. This is time to wave. If you want to elbow bump, even fist bumping, but shaking hands is the biggest transmission of germs, and then trying to stay some social distancing from each other as much as possible. I know a lot of workplaces are taking a lot of steps to try to get people working from home. Of course, you guys there at the station have been opposite sides of the studio and in other rooms and things to do that as well. And even the opportunity here for me to be with you via an app as opposed to being in person, those are all the things that you can do within your workplace. How can we separate a little bit more and decrease that risk of spread between one person to the other? Because in many cases, people don't know if they have this infection or not.
Well, we've quickly learned how innovative we can all be and the changes that we've had to make. But as people, are isolated in their homes and they're worried about the virus, they find themselves worried about their loved ones who may be in higher risk categories, their own finances going forward. How would you encourage people to cope with anxiety associated with that? I know sometimes people come into the emergency room and it is just that they're facing.
Yeah, this is a big thing. We're going to have a lot of stress right now. We're we're getting towards the end of winter, so everybody's kind of got that seasonal affective type issues right now. But then you throw this on top of it, there's a lot of anxiety, probably a fair amount of depression that's being involved. So the big thing is to spend quality time with that core family you have in the house, communicating via electronic devices with other family, especially your parents, if your parents are around, or if you're elderly with your children or other family members via the Skype and FaceTime and things like that. Also doing things for your own wellness, a good diet, regular sleep patterns, going for a walk like yesterday, in our little gaps between rain that we seem to have this time of year, taking my kids for a bike ride, just to get out and try to get some normalcy, because we can't go to a lot of different places, movies, things like that. But what we can do are some times that we probably needed to get back to doing anyway, which is just a good walk, spending time with family, whether it's electronically or not within the home, and just make sure you still have those connections. We're just having to do those connections a little bit differently. So for once, the millennials, though we tend as middle-aged folks to poke at the millennials, they may be onto something with the way they're electronically communicating, and we may need to learn something at this point.
They were well equipped to deal with this, maybe more so. All right, very quickly, Doctor, and I want to get you back to your important work. Right. Vaccine, is it on the horizon? Will that be some time away? We're all used to where you can just take a shot and it won't happen.
Yeah, I think it's going to be probably at least late 2020 before we see any significant access to it. And actually, I think even if we push it through quickly, we're probably going to still be 2021. And then, of course, it's going to be targeted for our higher risk populations, being the elderly, those in nursing homes, and then kind of trickle down from there. So for most of us in terms of the population, I wouldn't expect anything until at least 2021. I know we've got trials going on right now, some human testing for the efficacy and the safety of the vaccine that are already taking place, so it will be pushed through pretty quickly. But we also want to make sure, one, it's going to work, and two, it's going to be safe otherwise. And so we want them to take those important steps, then the production, then getting it out to the highest risk populations, and then stepping down from there. So don't count on that, at least until probably getting towards the end of our next flu season, the end of 2020 to 21.
I know this question is a lot to put on one guy, even a very experienced emergency room physician, but everybody just wants to know, when will we possibly return to some sense of normal? And, the government has indicated that they have plans for this potentially to go on for a long, long time. Hopefully that's worst case scenario from a planning standpoint. But can you give us, some sense of where you think it may be, to where there'll be some light that we can see out there?
I think we're going to see some return, probably getting into May, into June, especially if we can get those numbers to flatten out. And then remember, once we start to pull back those restrictions, we'll probably see the numbers tick back up just a little bit as we start to get those connections. But I think we're talking about May, at least May, if not June, for a lot of activities. And then a lot of the sports are going to be off until probably getting into late summer into fall. So I think it's going to be at least a couple of months. Hopefully the really strict restrictions that we're seeing right now, we can ease off within a month or so. But really, you have to have that separation. This has got about a 14-day incubation period in some cases. And so we have to have that separation enough. We shouldn't even expect to see decreases in numbers for about another week, because we've really only been with a lot of these restrictions for about a week now. And so we're only about a week until we start to see the benefits start to happen. And that's when we're going to start to seeing that flattening of the curve. And if we can make that last, and then hopefully the warmer weather will have a positive impact on this for us, we'll start to see that. So I would expect mid to late spring for most of us before we can expect to get somewhat back to normal activities.
Dr. Stanton, before we let you go right back to work, just quickly, is there anything else you would like to say as a professional or a citizen of this Commonwealth, or just one who is observing, and as we all are, living this history right now?
Yeah, in a country where the individual has been pushed up so high, this is a point where we need to actually live and make our decisions for us in this state, the Commonwealth. We need to make decisions for the common good of our friends, our family, our neighbors, making these small sacrifices. And really, I want to stress, these are inconveniences right now, with the exception of some folks who may have significant impact on their livelihoods, which is bad. But what we're talking about is life and health and safety. And by making these decisions and doing these things right now, we may save hundreds, if not thousands, of other Americans that can spend more time with us and be healthier because of these decisions. So a couple of months of these harder times for us, which are relatively not that bad compared to things that have happened in history, this is something that can make a significant impact in our future moving forward. And so hopefully we can all work together. This is a great time for us to support each other, to help each other. Don't forget about donating to charities and to groups, and help people out, especially the elderly that may be having a little bit more difficult time getting things. So those are the big things we need to do as we move forward.
Dr. Stanton, thank you so much. We really do appreciate you. Dr. Ryan Stanton there joining us from the emergency room this morning. All right, stay with us for historical perspective from longtime Kentucky historian Ron Bryant. Again, as we live history. Kentucky Newsmakers, we'll be right back. And welcome back to Kentucky Newsmakers. We have enjoyed talking with historian Ron Bryant over the years on a variety of topics. And this morning we turn to him to help us look back, but also to understand the history that we're all living through right now. Ron, thanks for being with us. We appreciate it very much.
Thank you.
Give us some perspective. I mean, this is a time that we will all remember. Do situations like this tend to transform the world?
Yes, some of these pandemics have completely changed the world order, and of course we think of probably the most familiar one to us would be the Black Death of the 14th century, which totally changed the makeup of Europe, and probably even expedited the discovery of America, to be honest with you.
Well, you're talking about the plague, right?
The plague, the Black Death. It was the bubonic plague, and that was actually probably one of the worst that ever hit the world. And between 1346 and 1353, anywhere from 75 to 200 million people died. And literally a third of the population of Europe was destroyed.
Wow. Looking back, the Spanish flu epidemic in Kentucky was really deadly. How did the state respond at that time, back in 1918?
Yes, in 1918, of course, one of the worst of the modern pandemics broke out, the so-called Spanish flu. Kentucky was like most of the United States at that time. We didn't have any great knowledge of what was going on, and nobody knew what to do with it when it first hit us. But to give you an idea of how bad that was, just within a short period of time, we're talking 1918 to 1920, over 14,000 Kentuckians died of that. And then and in the United States, some 675,000 people died, and worldwide, anywhere from 50 to 100 million, and we'll never know the number for sure.
And we have seen that it was prudent to act fast in some of the areas that did take precautions.
Yes.
Their situation wasn't as bad as it was in those who delayed.
No. In places, especially in places where the population wasn't so dense, the outbreak did not do as much damage. And in the 1918-20 pandemic, the Spanish flu, that was such a strange strain of flu that it killed young, healthy adults and left old and young relatively alone.
Wow.
And so that was one of the scariest things about that. And in some cases, Bill, you could have the symptoms of the and then die within 12 hours.
Do you think Kentuckians have been surprised by the extraordinary power that state government has, that the governor had in this situation to make closures and procedural changes?
I think it shocked everybody but it was the wise thing to do. If you don't act quickly in these things, it spreads, and it just spreads and spreads and spreads. By trying to close down things, by the government stepping in and saying, you don't do this, you don't gather here, you don't have, these big meetings and all, that will slow it down. And so it was the best thing to do, and if they had had some of this knowledge centuries ago, the death toll would have been much, much less.
Here was a new governor who'd just been in office a few weeks, and then all of a sudden faced with this. That is an extraordinary thing to have to deal with early in a term.
Oh, my goodness, that was one of the worst things that any governor or mayor or any person in civil authority would have to go through, because it catches you totally unawares. I mean, if you remember, this started just as a little blurb on the news, what was happening in China at the end of December. And here we are in the middle of March, and look where we are. I mean, that's how fast that has gone. So if we did not react, if the government did not react as well as it did, we would be in a lot worse circumstance.
A month ago, the economy was clicking along. People were watching the 401ks that were making their plans for retirements, and probably had a good time frame about that in some cases. This has certainly disrupted a lot of that. Give us some history on that, financial disruptions that America and Kentucky has faced over the years.
Through the years, there have been several economic downturns caused by a number of things. I mean, not always disease. But in this case, since the world economy is so tightly woven with the American economy, and therefore Kentucky being part of America, it touches everything. And literally, one of the great fears as a historian I have is more the economics than actually the flu, because the flu will die down. That will actually die down. And but the economy right now is on the mat, you might say. I have no doubt that we will recover from it, but it has given us a blow that you talk about people expecting things. No one could have expected how bad that has hurt American economy right now.
Right. Another piece of perspective, our primary had been set for May 19th. It's moved to June 23rd. We'll see if we're able to hold it then. But some may not realize we used to have an August primary.
Yes, we did, and actually that wasn't a very bad idea, to be honest with you. But we started going earlier in the year, of course. But in the old days in Kentucky, to have the August primary, you were getting close to harvesting time, and so a lot of the busy things on the farms were beginning to die down. Harvest would set in earnest, of course, in September. It just seemed like a very opportune time to have a primary to get people together in those days.
Would it appear to you that, at least for a time, that this will change the way Kentuckians look at each other, the way we look at public health, the way we look at togetherness?
Let's say it should. History is one thing. The lessons of history is something that we should adhere to very, very carefully. I mean, we've been given a very fair warning what could happen, and not to be a doomsayer here, but pandemics are going to happen constantly throughout the future, that's just part of nature. That's one way nature controls population. And so we need to be prepared, taking lessons from this. We need not to be reliant on other countries for, our drugs or things that we need to combat these. The United States is a very powerful country and a very rich country. We could take lessons from this and be totally prepared for the next outbreak, whatever it may be.
All right, let's hope we do. Ron Bryant, Kentucky historian, we appreciate it very, very much, and good luck to you. And
Thanks.
We'll be back on WKYT's Kentucky Newsmakers, and we'll look at the federal response. And welcome back to Kentucky Newsmakers. President Trump is calling himself a wartime president. He and his administration are combating a pandemic at this point, and our national political analyst explains.
Hello, I'm Greta Van Susteren, and here is your Full Court Fast Break. We're at war with an invisible enemy, the novel coronavirus. It's skyrocketing in the U.S., with officials now reporting more than 7,000 cases and more than 100 deaths. The federal government is scrambling to address medical shortages. Wednesday, President Trump invoking the Defense Production Act to boost the manufacturing of protective gear. The Defense Department also announcing plans to distribute 5 million much-needed respirators and 2,000 ventilators. Meanwhile, President Trump dispatching hospital ships to New York and the West Coast, adding 1,000 hospital beds to both hotspots. And now, HHS allowing doctors to work across state lines to where they are most needed. The U.S. and Canada are also closing their border to non-essential travel. That does not include trade, but the economy is suffering. Businesses are shutting down, laying off employees. Treasury Secretary Steven Mnuchin warning unemployment levels could surge to 20% if the government does not intervene. The Senate just passed the House's coronavirus economic relief bill. The White House is also pushing for a $1 trillion stimulus plan. Want more Full Court Press? Tune in Sunday. We bring politics home, covering the national stories that impact you.
And remember, you can catch Full Court Press with Greta Van Susteren this morning at 11:30 on WKYT. Quick reminder, the Kentucky COVID-19 hotline is 1-800-722-5725, and the website is kycovid19.ky.gov. That's Kentucky Newsmaker.